Hi friends, welcome to classes by Lab Doctor. In today's class, let us discuss about the normal range of triglyceride. You all know that triglycerides are a form of fat. These lipids we get from the food we eat. When you are eating more than what is required, this excess calories will be stored in your body in the form of triglyceride. So the body will think I will use this during the time of need. Suppose at a later date you do not get food, you are starving in between meals, you are exercising, you need energy, and this energy will be utilized from the triglyceride. So it is the body which stores these unused calories as triglyceride, and it will stock it so that during the time of need it would be able to provide you the necessary energy. So increased triglyceride is called as hypertriglyceridemia, and this can put you at a risk of developing heart disease and blood vessel disease, vascular disease, etc., and can cause heart attack, stroke, etc. So now what is the normal range of triglyceride in the adult? So the normal range in adult would be less than 150 milligram per deciliter. If it is between 150 to 199, we call it as borderline high. Suppose it comes from 200 to 499, then it is high. And if it is more than 500, if it is more than 500 milligram per deciliter, it is very high triglycerides. The level of triglyceride changes in young adults too as we age. It also changes men, women, children. So remember, men tend to have a higher triglyceride level compared to women. Okay, so in the middle age, what happens? As we age, the level of triglyceride continues, and in women, when they attain menopause, the level of triglyceride will increase because the good effects of estrogen are reduced, or they are not available after menopause, and hence the level of triglyceride can increase in women after menopause. So as we age, in the older age, we will see that the older adults try to have triglyceride level higher than the younger adults, and we will see that in children we expect the triglyceride level to be less than 90 milligram per deciliter. That is considered as normal in children, and in adults we considered a triglyceride level below 150 milligram per deciliter as normal. So now what are the risk factors for high triglyceride? I've told you that if you have a family history of high cholesterol or high triglyceride, your triglycerides can go up. If women who have attained menopause, the risk of developing hypertriglyceridemia increases. Pregnancy, there is increased risk of getting high triglyceride. If you are having HIV, or if you are on an HIV medication, that can also increase your risk of developing this dyslipidemia. So what are the causes of high triglyceride? We have dealt with what are the causes of high triglyceride in our previous videos also. In detail, we have explained why each of these can cause increased triglycerides or they can cause dyslipidemia. But remember, the main cause of increased triglyceride is you are eating in excess than it is needed. You are having increased amount of saturated fats, you are having high fatty food, you are having increased carbohydrate rich food, you are having food which is rich in sugar, junk food, trans fats, etc. And when these are processed, they can spike up your triglyceride. Body will store this excess of these calories as triglyceride. So yes, definitely the kind of food we eat, and nowadays we eat more than what is required, and that whatever we have eaten more than what is needed gets stored in the form of triglyceride. Second would be our sedentary lifestyle. We are not moving, we are not active, we are very sedentary, there is no exercise, and this kind of a lifestyle wherein we are not burning the kind of calories we are consuming leads to storing of these calories in the form of triglyceride. And because of this sedentary lifestyle and eating more calories than we require, we develop obesity. So when you are obese, when your body mass index is high, you are overweight, that can also increase your triglyceride. You are consuming alcohol excessively. So whenever there is an excessive alcohol consumption, alcohol itself is rich in calories that will be converted into triglyceride. It will interfere with the lipid metabolism that can also cause increase in triglyceride. Smoking, when you are smoking, the good cholesterol level gets down, the LDL, the bad cholesterol level is high, that can also lead to increased triglycerides also. So smoking can cause increased triglyceride level. If you are having an unmanaged diabetes, because you know insulin is very much important in lipid metabolism, insulin inhibits lipolysis. So whenever there is insulin resistance, there can be deranged lipid metabolism, and that can cause increased triglyceride level. Whenever there is a liver disease, liver is a main source wherein we metabolize this triglyceride. So if there is a liver disease, if there is a kidney disease can cause increased triglyceridemia, and increased triglyceridemia can also damage the kidneys. So if you are on certain medications like corticosteroids, hormones, beta blocker, HIV medications, etc., that can also rise the increased triglycerides. If there is a chronic inflammatory disease like rheumatoid arthritis, autoimmune disease, etc., this chronic inflammation can derange the lipid metabolism, and that can cause hypertriglyceridemia. Thyroid disease, you are having hypothyroidism, the clearance of this triglyceride itself is deranged, that can lead to increased triglyceride level. So all these can cause increased triglyceride levels. So what happens if the triglycerides are more? So if the triglycerides are more, you are at risk of developing your coronary artery disease. You are at risk of developing this atherosclerosis that can block your heart vessels, and you can have an heart attack. You are at a risk of developing carotid artery diseases, decreased blood flow to the brain, and you are at risk of developing stroke. You are at a risk of developing peripheral arterial diseases. You will have claudication, pain in the leg, in the arms, etc. You can develop metabolic syndrome. It is a combination of high blood pressure, diabetes, obesity, central obesity, hypertriglyceridemia, etc. Increased triglyceride can put your pancreas at risk. It can cause pancreatitis, which is nothing but a severe and painful inflammation of the pancreas, and it can be life-threatening also. So, increased triglyceride can pose various health risks. So how often should you get your triglyceride test done? So high triglyceride has now become very very common, and it is a problem which we are seeing now in children also. So if you are an adult in your 20s, 30s and early 40s, you can do your cholesterol or triglyceride levels for once in 5 to 6 years you can get it done. If you are having diabetes, there is a family history of high triglyceride, cholesterol, or there is a heart disease in the family, there are other risk factors, yes, you will need more frequent tests. Suppose if you are over 45 years male and you are more than 55 years in female, then it is better to get this triglyceride once in a year. So annually that would be better, and you have to discuss with this with your cardiologist. You will have to see your risk factor, and accordingly we will have to get your testing done. So I've told you that these are the factors which are influencing your triglyceride: your diet, your obesity, lack of physical activity, and medical conditions like diabetes, hypothyroidism, kidney disease, etc. And why monitoring of the triglyceride becomes important is, especially if we are having risk factors, we can detect the hypertriglyceridemia. We can try and give you certain medication, make some lifestyle changes, and we can deal with the problem at a earlier stage. Do children need triglyceride test? Yes, sometimes children also will need this cholesterol and triglyceride test. Usually what happens is when the children are around 9 to 11 and they are having, family history, or they are obese, they are overweight, etc. We even advise the children to have this triglyceride test regularly done, just to see whether they are having hypertriglyceridemia, and also the sugar monitoring to see if they are developing insulin resistance. So remember, the normal range of triglyceride should be less than 150. If it goes from 150 to 199, it is slightly high. If it is going beyond 200 and reaching up to 499, yes, it is high. And if it is cross 500, it is severely high or very high triglyceridemia. And in children, we expect this triglyceride level to be less than 90 milligram per deciliter. This becomes important because triglycerides can pose various health risks. So that was about the normal range of triglyceride in adult and children. Thank you so much for watching the video. Please like, share and subscribe the channel. Thank you.